The ban on non-essential gatherings of persons of greater than 100 or greater. So a ban on non-essential gatherings of persons 100 and greater in indoor areas. So in outdoor areas it's 500, indoor areas it's 100, and that is effective now, as of today. And those arrangements in terms of the legal enforcement of those measures are being put in place by the states and territories. We are upgrading the travel ban on Australians to level 4 for the entire world. That is the first time that has ever happened in Australia's history. The travel advice to every Australian is do not travel abroad. Do not go overseas. That is a very clear instruction. For those of you who are thinking of going overseas in the school holidays, don't. Don't go overseas. Whatever we do, we've got to do for at least 6 months. 6 months. So that means the disruption that would occur from the closure of schools around this country, make no mistake, would be severe. What do I mean by severe? Tens of thousands of jobs could be lost, if not more. The impact on the availability of health workers, a 30% impact on the availability of health workers is our advice. That will put people's lives at risk. So let's keep our heads as parents when it comes to this. Let's do the right thing by the country and by each other and follow the proper advice. There is a national public interest here in keeping schools open, and our advice is that is not being done at the detriment of the health of any child. The following visitors and staff, including visiting workers, should not be permitted, will not be permitted to enter an aged care facility. Obviously, those who have returned from overseas in the last 14 days. Those who have been in contact with a confirmed case of COVID-19 in the last 14 days. Those with fever or symptoms or acute respiratory infection symptoms. Those who have not been vaccinated against influenza after the 1st of May. The facility must also implement the following measures for restricting visits and visitors to reduce the risk of transmission to residents. Limiting visits to a short duration. Limiting visits to a maximum of 2 visitors at one time per day. These may be immediate social supports, family members, close friends, or professional service or advocacy workers. Visits should be conducted in a resident's room, outdoors, or in a specific area designated by the facility, rather than communal areas where the risk of transmission to other residents is greater. There should be no large group visits or gatherings, including social activities or entertainment, to be permitted at this time. No school groups of any size should be allowed to visit aged care facilities. Stop hoarding. I can't be more blunt about it. Stop it. It's not sensible, it's not helpful, and I've got to say it's been one of the most disappointing things I've seen in Australian behaviour in response to this crisis. That is not who we are as a people. It is not necessary. It is not something that people should be doing. What it does is it is distracting attention and efforts that need to be going into other measures to be focusing on how we maintain supply chains into these shopping centres. There is no reason for people to be hoarding supplies in fear of a lockdown or anything like this. Stop doing it. It's ridiculous. It's un-Australian, and it must stop. Last week, we focused very much on the stimulus type activity, encouraging investment, encouraging demand into the economy, providing support to small business. The measures that we are focusing on now are of a different nature. They are focused more on the cushioning impact of the safety net for individuals and on small businesses. The Reserve Bank has been involved in our discussions on those issues. They'll obviously make their decisions independently as is appropriate. But we are putting in place further measures, and we will announce them once they've been properly designed and they can be properly implemented. We are not delaying, we are moving with great haste on this, but we're doing it carefully to ensure we get the design of those measures right so they can be implemented as quickly as possible and provide that support. We'll continue to update you as regularly as is possible with clear decisions on what we're doing, but on the misinformation, just ignore it. If you hear it from me, if you hear it from a Premier, if you hear it from Dr. Murphy, if you hear it from those official sources and websites, that's the information you should follow. if you're hearing it from someone just saying whatever pops into their head or whatever their opinion is on a particular topic, opinions are interesting, but everybody has them. Facts are important. Information is what we need to make proper decisions on, and you need to make proper decisions on. And that's why we'll give you the information as best we can and as regularly as we can.